Ascellon is a provider of health solutions to government. We do everything from surveys to risk validation and adjustment to help agencies fight fraud, waste, and abuse. Right now, from international organized crime units to individual American citizens, our healthcare systems are under assault with massive amounts of criminal activity. It's costing the American taxpayers about $80 billion a year. So this whole idea of fraud in healthcare is a very real thing. So right now, especially coming out of HHS, there is a real effort for agencies to invest in fraud detection technologies to really fight this battle, because it's coming at you whether you like it or not. And if you keep yourself as a sitting duck and you don't look at innovation, because trust me, the criminals are. And they're coming after you in a really hard way, that you need to understand how to protect your agency and how to look for areas where fraud, waste, and abuse can occur. The bottom line, I think the recent statistic is that for every dollar that a government agency will invest in a fraud detection system, they're getting a $6.80 return on that. Ascellon, we've been in this space for 15 years, and we created a business analytic tool called Answers, and it was a result of being in the agencies year after year where we got asked to do customized programming to find different angles of fraud, waste, and abuse. Answers is a post-payment claims analysis, data mining, and medical records review that helps agencies detect fraud, waste, and abuse. We have used this to recover fraud at a federal level, and there's a couple different things that they're finding. One, we have a return on investment that far exceeds the $6.80. It's about triple that. And the other thing that they've found is that it's a very easy to use analytic. One of the big problems out there with a lot of the fraud, waste, and abuse tools is that you need a programmer that usually has to go through intensive training. And one of the wonderful things about the Answers product is that your analyst, your workers that are out there in the field will need very little training to use this. There are 3 reasons we partnered with Microsoft. One of the big ones is that when you introduce a new software product to people, one of the biggest reasons why people don't adopt new systems is they're not familiar with it. There's a lot of training that gets involved. Our fraud, waste, and abuse analytic is on the Microsoft platform. So here's what that means. Anyone that I'm talking to, if they can use Word, Excel, and are familiar with a Microsoft web browser or dashboard, they're going to be able to use this product with minimal training. The other key reason that we joined the Microsoft Health Alliance is that we have trusted relationships with some of the great leaders in industry. The other reason, and this is a very important area, is that many companies lack of vision. They react to what's going on in the technology marketplace, but they don't understand where the healthcare market is ultimately going. And Microsoft truly understands and has a vision of where healthcare technology is going in the future.